Let's look back at last night's film, the fourth in the series, called Collapse. It tells the story of 16-year-old Bernice Atwood, who's in a disturbed ward in a large psychiatric hospital. She's had serious problems in her relationship with her parents, and she's tried to set fire to her home.
Now you know you've got to take them.
Bernice, now be a dear and take your medication. You don't want your trouble flaring up again, do you?
Please, it won't.
Bernice, be a good girl.
Bernice is moved to a smaller, more open ward, which is a therapeutic community. There she takes part in group sessions, begins to relate to other patients and staff, and develops her own artistic skills.
How's it going?
How's it going? It won't come right.
Who's it meant to be?
I don't know.
The plan for a group home in the community fails because of local authority cuts and complaints from the neighbours. And even the therapeutic community in the hospital has to close through lack of funds. Bernice is deeply disappointed and reverts to her past more violent behaviour. She's returned to the disturbed ward and put under sedation.
That's a good girl. Well, did you swallow them?
The mentally ill account for a quarter of the UK's NHS beds. That's 110,000 beds. And the young mentally ill, that's young people under 25, accounted for 20,000 hospital admissions in England in 1981. Most of these people are still looked after in huge 1,000-bed hospitals built in Victorian times, when the Lunacy Act of 1890 made no distinction then between the mentally ill, the mentally handicapped, and people with social problems, like drunkenness. In the studio to discuss this whole area are Tessa Jowell, who is Assistant Director of Mind, Dr. John Ashton, Lecturer in Community Health at Liverpool University, Peter Leakey, Principal Clinical Psychologist at North Derbyshire Health District, and Dr. Leonard Fagan, Consultant Psychiatrist at Claybury Hospital. Dr. Fagan, what did you think of the film?
Yes, well, I found myself recognising a number of situations and people that I've actually experienced myself or, in fact, read about. And I think many of you are familiar with the sort of scandals that often reach the newspapers, and I think that are highlighted in this film. But I felt, on the whole, that it doesn't reflect my own experience in working with the health service. I think that throughout this programme and through the previous programmes as well, I found that there was a sinister quality to what is going on in the health service, that it's pervasive throughout, as if it's very conspiratorial. And the staff are shown to be either harassed or uncaring or detached or conspiring. And that certainly does not reflect my own experience in working with other staff in the National Health Service.
Dr. John Ashton, what did you think of the film?
Well, I would go along with some of those remarks that Len Fagan's just made. I think it would be unfortunate if the series as a whole were to give the impression that NHS staff aren't, by and large, totally committed to the welfare of the patients. I don't think that's really the main point coming across from the series so far. I think what is clear is that staff are labouring under grossly inadequate resources and provision and trying to help people. And I think what we're witnessing here, and it's brought out very well in this one today is the way in which a fashion, in a sense, a desire to change to a completely different style of provision for the mentally ill has fallen between all the political stools, and as a result, the provision that's available may well finish up being worse than what was on offer before.
The Nation's Health film, and indeed, if you all saw One Flew Over the Cuckoo's Nest, suggests that treatment in large disturbed wards has not progressed much over the years, and that drugs are being used as a convenient way of containing patients. Do you agree with that?
I think that it's inevitable that at a time of cuts and when staff are under enormous pressure, that the sort of exciting therapeutic initiatives that we saw in the 1960s will be lost, and that the easy way out will inevitably be taken, which involves more use of pharmaceuticals. I think that's inevitable that would happen.
Can I say something
yes.
here? Because although I'm not an advocate of drug therapy on its own, I think there are 2 points that need to be made. One is that they are obviously a useful tool, but it shouldn't be seen as the only tool that is practiced in psychiatry. And what's more, what must be emphasized is what John is saying, that under cuts, it's more likely that people are going to have to use more restrictive measures because there aren't enough staff to deal with patients in other ways.
Tessa Jowell, what points do you think the film brought out well?
I think there were 2 points which, for me, emerged particularly clearly. First, the extent to which both staff and patients are victims. Victims of a system which, as we've already heard, doesn't serve the best interests of the best standards of patient care. How staff particularly are victims of decisions over which they have no control over the future of the service that they're responsible for providing. And I think the second point that it made very clearly was just how very far we have to go in educating the public about the needs of mentally ill people and their families.
The problems that I think that have been highlighted in the programs have been ones in which hospitals are not safe. Therefore, the community does not become therapeutic. And I think we must go always back to that point of view.
Are there many patients, do you feel, in large disturbed wards that could benefit from the sort of smaller community groups that you've both set up? And if so, why are there so few of them? Why is there only one per hospital?
Well, that's not exactly the case. There are some hospitals that have experimented with working with therapeutic communities as a whole. Dingleton and Claybury are examples. Usually it starts off in one area in the hospital, and it starts affecting the rest of the hospital as well. And yes, the level of disturbed behavior decreases, the morale of the staff increases, and you generally get a halo effect on the whole hospital. But it's usually when you're met with external restrictions when the problem of the therapeutic community falls down.
On Monday, the mental health charity Mind published a report called Common Concern, detailing a blueprint for the development of locally based mental health services, which it is their hope will replace the big psychiatric hospitals with small district hospitals, day centres and small units outside large hospitals. Tessa Jowell is an assistant director of Mind. Tessa, why did you and your team decide to write Common Concern, which you describe as a manifesto?
Well, indeed, because we don't want another 21 years to pass with politicians, professionals, mouthing all sorts of good-intentioned objectives about moving people out of large hospitals into the community, and precious little happening. So Common Concern is an attempt to describe a blueprint for action.
What do you hope to see in terms of psychiatric care in the 80s?
First of all, the planning, the development of the services would be on the basis of what people receiving those services need and want. We would get away from the situation which we've inherited for generations, where the very experience of being in hospital, of being mentally ill in hospital, can be itself disabling, separated from the world, separated from the responsibilities and experience of everyday life, separated from family, friends and normal social relationships. Second, we would want to see the most urgent priority being given to developing services for the people who are most deprived, people who are elderly, and whose desperate needs are very often overlooked, people who have had repeated admissions to hospital. And third, we would want to see the service being properly funded and bringing together in concert and in harmony and effective working partnership the health service, the local authority services and voluntary organisations, not forgetting families and the families who provide 90% of the care for mentally ill people.
Well, Dr. Fagan, your hospital, Claybury, and another, Free and Barnet, are due to be closed in favour of community-based psychiatry, similar to the sorts of aims that Mind's document has. Can you see any danger in a change like this?
Our own experience at Claybury has been that as a result of the region telling us to actually look into setting up alternatives to a large psychiatric hospital, we did engage in a very useful conversation with the Community Health Council, with Mind, with other professionals and so on, and developed what we felt was a plan in which a suitable alternative could be put forward. But once again, here we're met with a response from those that are going to sign up the money in saying that they're not prepared to afford such a service. And now we're in a situation of uncertainty where we don't know what it will happen if the hospital closes down.
Dr. Ashton, you work now in a sense on prevention. People who arrive in psychiatric hospitals often have problems that it's really too late to control. Could some of these be prevented or avoided earlier on?
Well, I think it has to be said, first of all, that the group of patients who are seen by hospital psychiatrists, either in hospital or in outpatients, are a very selected group. By the time they've got there, they've already mostly been through the hands of a general practitioner. And a lot of the actual burden of emotional problems is actually to be found either in the community and never coming into contact with any health professional at all, or else in general practice. And it's just the very severe problems that tend to get into hospital. One of the problems that I see about the community care approach, unless it's properly seen through to the end with the commitment that that requires in terms of resources and training, is that we will replace one system with another, which is not perfect either and doesn't work properly and doesn't deliver the goods. As a community physician, what I'm concerned about is that the complete population of people who have a need for a service are able to obtain it. And the evidence is, unfortunately, at the moment, that the majority of general practitioners are not interested in devoting the amount of time to psychiatric problems that's required, and that there are other training needs for psychiatrists themselves, who very often feel much more secure and comfortable working in hospitals than actually working out in the community.
In Mind's blueprint, it says that counselling and psychotherapy are hard to come by, but are more often effective than, and I quote, fruitless investigations and drugs if the patient isn't helped to face psychosocial problems. Now, what can be done at an earlier stage to nip some of these problems in the bud? Could things be done in school with psychotherapy or psychoanalysis to help children prepare for marriage for children?
I think that one has to consider two separate issues here. The first one is actually the question of identifying and helping people who have problems at an early stage. And I would hope that in the future, primary health care workers of all sorts would have a much more extended role in that. But as I was implying just before, there's a major training task to be done there and a commitment of resources. But going back further to real prevention, which is the question of actually producing adults who are mentally healthy and robust, we haven't even really begun to approach that. And when people talk about prevention in mental health, they usually are talking about the thing I was talking about first, which is really secondary prevention. It's early identification of people with problems.
Tessa, you want to
Every year, some 27 million prescriptions are issued to patients attending their GPs to provide them with drugs to help them cope with life more effectively. And we firmly believe that if albeit more time-consuming treatment alternatives, like talking treatments like psychotherapy and counselling, were offered, not necessarily by the GP, but by counsellors attached to the GP. That would provide a far more effective service, would actually prevent further deterioration and distress in the patient concerned.
It seems to me that we're all looking forward to non-big hospital-based psychiatric treatment. But, Dr. Fagan, I'm still worried that the sorts of recommendations made in the Minds Blueprint are so diverse and depend so much on local authority funds that some of the patients that are getting good treatment from you in Claybury are going to suffer.
I mean, can I point out, I mean, that basically, I mean, this idea of community care is not a new one. It's something we've been endeavouring to pursue for a few years. We've got a community mental health centre, which is seeing at the moment people outside the hospital and working in close liaison with GPs and not necessarily only by psychiatrists, and where counselling and psychotherapy and family therapy are being used. But the problem is that it's labour intensive. Community psychiatry is not cheap.
We have a few seconds left, Tessa.
Just very briefly, the central point in our report is that you justify developing the new pattern of service by improving the service, and that improvement is measured in terms of its effect on the individual patient receiving the care and support.
Would you like to see all the big, large hospitals go?
We'd like to see their services replaced, because at the moment any large hospital is fulfilling a multitude of functions way beyond the specific medical treatment function that hospitals are expected to provide.
I'd like to make a final point, if I can just come in. If we're serious about mental health as opposed to mental illness, then we've got to address ourselves to the big issues. Issues such as unemployment, poverty, and education for life and for living. Because really, if we're talking about positive mental health, we're talking about people being in control of their own destiny and feeling a sense of some power over their own lives. And if the government believes it is the government of the family, the party of the family, then it should be providing support for families to bring up healthy children, to be healthy adults functioning healthily in their social and personal lives.
Thank you.